What's up, everyone? Welcome back to the Daily Sean. For those of you who haven't been here before, my name is Sean. I do a daily video on something related to nursing. No rhyme or reason. Probably not going to change. I had a tribe member ask me to explain cluster your care and why it was important to me. Clustering your care. This was something I shared a while back when I had asked the question to the tribe, what was the best piece of advice that you ever got as a nurse? And this could have been at any point in your career. For me, this piece of advice, clustering your care, came at a time when I needed it most. It was a time of my career when I thought I had it all down and I thought I knew what I was doing. Somewhere around, the 18-month mark, 1 year, 2 year mark, somewhere around there, I'm pretty sure I thought that my shiz didn't stink, okay? I had it figured out. Then I changed jobs and started working in a much bigger, a much busier ICU that had much sicker patients. And I learned how much I don't know and how much I needed to learn. Every shift is dictated by the time clock. How much can you get done in the short amount of time you have? No matter how long that shift is, there's never enough time in the day. Being caught up is a rare thing, especially with the level of care that we have to provide. So figuring out how to budget your time wisely was one of the most important pieces of advice I got because it lowered my stress level. I was able to not feel like I was dying every shift. I didn't feel like I had somebody stepping on my neck. I didn't feel like I was running nonstop. In other words, I felt a small bit of control. Clustering your care is learning how to do more than one task in one trip. If I had to give a description, you want to think of every single patient scenario like they were in precautions. You need to plan ahead when you walk into the patient's room, when you interact with the patient, when you assess them. You not only assess them, but you assess the room. You assess the equipment. You assess everything in the immediate vicinity of the patient and you. An example would be how long it takes you to do a simple task. We're going to give it a 2-minute time label. So everything you do takes 2 minutes. Stick with me. So when you walk into the room to assess your patient, 2 minutes. You have to change the IV tubing on a medication, 2 minutes. Your IV fluids run out, 2 minutes. Your tube feedings run out, 2 minutes. Every time your patient clicks the call bell for whatever it is they need, 2 minutes, 2 minutes, 2 minutes. They need another pillow, 2 minutes. They need another blanket, 2 minutes. They need more water in their pitcher, 2 minutes. They don't have a cup for their water, 2 minutes. They don't have socks for their feet, 2 minutes. You go to give a medication and you don't have the supplies. Oh wait, I don't have the right size needle, 2 minutes. I don't have the right size syringe, 2 minutes. I don't have any flushes, 2 minutes. Oh, I forgot alcohol wipes, 2 minutes. You can see how this adds up. I think I'm pretty sure we just accumulated 20 minutes right there. I don't know about you, but 20 minutes on one patient puts me way behind schedule. So the idea is you walk into your patient's room and you get a layout of the land. Figure out all the equipment you need. You have to use your anticipatory judgment, meaning throughout your day you're going to have to do things for your patient in the room. Do you have everything you need to do that? Does your patient have everything they need for your shift? This is a skill that takes a great deal of time to master. But it took someone actually saying out loud, cluster your care, before I kind of figured it out and before the synapses started firing and the dots started connecting. Oh wait, I could do all of those trips in one trip instead of having to walk in and out of my patient's room 10 times in 5 minutes. The longer you do this job, the better you get at it. And that's why cluster your care became so vitally important, because I still do it to this day as a nurse practitioner. I cluster my care when I walk into the room. And maybe I'm not doing bedside nursing the way I used to, but I have to care for and I have to help manage 10 plus, 15 plus patients. So my level of organization still has to be on point. Curious, do you cluster your care? When did it click for you? When was the first time somebody pointed out this concept to you? Were you a nursing student? First year, second year, fifth year? When did the light bulb come on for you? Leave me your comment down below. You know your comments are my caffeine. Share this with somebody. Share it with everybody. Share it with any nurse that could benefit from this. Share the vlog and pass it on. And as always, check your own pulse first.